So for someone that's really interested in saying, okay, this sounds like it's more than just throwing magnets on the body and and seeing what happens, because there is science to it. There's absolutely experience behind it, and a lot of practitioners are utilizing this all over the world. So if someone is wondering, what does a session look like? If I were to come to you, let's say, and have some kind of pathogenic infectious disease that has not responded well to antibiotics, that has not responded well to other conventional means, and maybe you've been on a herbal supplement too, or protocol, and that hasn't gone well, what would that look like if they came to you?
Well, it's all very simple. I think, first of all, people need to understand that what we do is completely non invasive, 100% safe. So, first of all, let's get, that worry out of the way. And also, I should say before I say that, there's one type of person that I do not treat at my office. That person is someone who is currently going through chemotherapy. And it's not because magnets will hurt you. On the contrary, magnets help restore your balance, which then causes the chemotherapy to be absorbed differently into your body, and then it can be harmful. So I just wanted to say that those two things before I go into the explanation of most people come into the office. It's a very simple, it's a very quick intake. What are your top 4 to 5 symptoms that are bothering you? I want to know if people are on chemotherapy, and I want to know if people are on immunosuppressant drug therapy. That's important for me to know. Then they just go into a little room, they lay down on a little therapeutic table, and I do a form of, people would probably know muscle testing over the term bioenergetics. So we do a form of muscle testing, and that's how we diagnose, and that's how I'm able to determine where magnets need to get placed. So a person is laying there, then I'm placing magnets on them. Once I'm done with that process, which takes somewhere around 10 to 15 minutes, then a person is laying there for, here on my latitude where I'm at in California, people will lay there for 27 minutes while the magnets do their job there. And that's it. People get up, and some people are like wondering, what's going on here? What was that about? And other people would say, oh my God, I felt a lot of tingling or movement inside, or I feel more peaceful, more relaxed. So that's kind
And
of.
and that's really because the magnets themselves, the two poles operate, are basically sending these fields correct through the body that are then changing, or you could say adapting and changing the pH, correct? That's what's going on. So you would put one, let's say, near the spleen area, another pair somewhere else that has been researched. And Dr. Glois, who I believe you trained under as well, correct?
Yes.
He's known as kind of the father of biomagnetism, and he had these biomagnetic pairs. And I've seen his work as well as where the pairs would go. So you put one spleen or somewhere on the thorax or somewhere else on the body, and that then is impacting a certain area, correct? That would have some sort of pH imbalance, possibly inflammation or degeneration in that area. And the magnets themselves are then changing that correctly through the different polarities and electromagnetic fields.
Correct.
Okay, so that is what happens. And you say you're doing it for 27 minutes. What are the types of things? Because we talk a lot about, when we talk about terrain, you talk about pathogens, but it doesn't just stop there. Terrain's so important for so what are the types of conditions and diseases you've seen have been beneficial, have improved with biomagnetic therapy?
Well, first of all, 99.9 of the people who walk through my doors don't know what else to do, because everyone has gone the medical doctor route, acupuncture, chiropractic, all those things that are well known and common and have existed for a while. That's where people usually go first. I seem to be the last one because it's so new. There's just so few therapists. So I don't see a one type of person. I see all sorts of things: cardiovascular issues, kidney, everything, you name it, even mystery illnesses where they keep saying they're fine, but they feel terrible. Um, I would say that the majority of people, independent of what their circumstances are, whatever their signs and symptoms are, have great improvement. There's a great shift within the week. So it's I can't really say one thing or the other just because I see it's just so broad in the spectrum of people that I see with types of problems.
Yeah. And I think when you're going after root causes and not conditions themselves, which are just a description of symptoms in a sense, that's your diagnosis is based off of that. When you go after root causes, I think there's always this ability and necessity to improve the terrain and the pH. Almost every single patient that I know, when speaking with doctors, they state that their patients always have some kind of pH imbalance, some kind of toxicity levels that are unacceptable, that are contributing to the state of disease. So in that case, something like biomagnetism does a great job of addressing what is causing you to have your symptoms, therefore your diagnosis and disease.